Welcome to this update focusing on the UK. A lot of interesting data from the United Kingdom come out in the past couple of days, so I wanted to take a bit of time and do it in an unrushed way. And also this is showing us a lot of general principles about how the pandemic is unfolding and how it's likely to unfold over the next few months as well. So getting on to Actually, just before we get on to the detail, let's just show you this picture for a bit of context. Now, this is a logarithmic scale, so we see that the numbers of cases have been very high. This is the new number of cases per day. And in Europe, as we know, these numbers have come down quite nicely, but there's a resurgence all over Europe. So we see a sharp increase in Norway. Numbers still relatively low, but a sharp increase. Italy, Germany going up, UK going up, France going up. Belgium has been going up, now going down slightly. But we did notice in the previous video that the number of admissions to intensive care in Belgium have doubled over the past 2 weeks because of the lag effect that we always get between the increase in cases, the people admitted to intensive care, and then ultimately the death. There's always this lag. So what's happening in the UK is consistent to a large extent with the rest of Europe. Spain is probably the worst at the moment. The cases are going up quite a lot in Spain. They've got a lot of clusters. And it's not surprising because given that we've reduced the lockdown measures significantly, it was inevitable that we would get some increase in cases, and that's what we're now seeing. The question is, how do we handle it? And at the moment it's being handled largely by a regional approach. We looked at the localised approach in Liverpool yesterday, for example. There was the lockdown last month in Leicester, the lockdown in the Greater Manchester area that's going on now, or the degree of lockdown, the restrictions. And indeed other areas in the UK that may require more rigorous local restrictions in the near future. And in Spain, we noticed that they had, I think it was over 500 clusters that they're trying to contain at the moment. So we've got this kind of smart lockdown strategy. But let's try and hang this on real numbers. So the real numbers, difficult. That's the number of people that have tested positive. But 2.8 million is the number of people that have had the infection in the United Kingdom, probably. Now that 2.8 million number comes from the Office for National Statistics, which does a study of all the people in the country and works out how many are likely to have had the infection. And this is based on antibody studies. Now the real number could actually be higher than 2.8 million because the antibodies usually aren't going to stay in the circulation for longer than a couple of months. So what this data means to me is at least 2.8 million people in the UK have had the infection. It could well be higher than that. So we've got these two ways of measuring the number of people that have had it, the positive antigen tests and the mathematically derived figure from the Office for National Statistics. But the Office for National Statistics is remarkably good at this kind of thing, so that 2.8 million number is going to be certainly more accurate than that 300,000 number. Now again, the deaths are difficult to calculate. There's different ways of doing it. That 46,000 deaths, that's the number of people that have tested positive and died. But of course a few people have tested positive and then died of something else. But actually not that many. So the vast majority of these 46,000 deaths were COVID-related deaths. They tested positive. But of course there was a few people who tested positive and then died of a heart attack or died of a stroke or died of a trauma, but not that many, just 1,000 or so. So these are mostly COVID-related deaths, maybe 44,000 of them, something like that. Now, if you relate that number there to that number there, that gives us 15% case fatality rate. We know it's not that. But if you relate that number there, the 46,000 diagnosed cases, to the 2.8 million, that gives us an infection fatality rate of 1.65%. Now that is pretty high. And it doesn't take a genius to work out that if 1.6% of the world's population who get this are going to die, we're dealing with many, many tens of millions of deaths in the world. But in many poorer parts of the world, the demographic is younger than the UK. So that means less people are going to die because younger people are infected or affected less severely. Less likely to die, which of course is great. But in the very parts of the world that are poorer with a younger demographic, they have a greater burden of other comorbidities. Malaria, dengue, tuberculosis, malnutrition. Did I say tuberculosis? Malaria, but all these sort of infectious diseases, they have many more of those. So how they're going to balance that out, we don't really know yet. The comorbidity data we have so far is for Western-style diseases, which we understand to some extent now, and we've covered it extensively. Diabetes, the high blood pressure, the heart disease, the chronic lung disease. So is that going to end up being is that 1.6% going to end up being the global case fatality rate? With 70% of the world's population, we're looking at tens of millions of deaths if that's the case. Let's hope it's not. But let's go on thinking about facts rather than speculating. So deaths with a positive test result, as we've said, is that. Now, we can look at deaths in a different way. And this number here is deaths where the doctor who writes out the death certificate thinks that COVID-19 was the most likely cause of death. So this is kind of a clinical diagnosis now. And of course, the doctors working on the front line that are diagnosing deaths are now quite experienced at this. So this is probably the more accurate number. So the number of people that have actually died in the UK of COVID-19 is probably 55,763. And of course, that means that not all of these have been positively tested before they died, but that was diagnosed clinically. Now, if that's the case, if there's 2.8 million infections and 55,763 deaths, that gives us an infection fatality rate of 1.99%, which is higher. So, if we look at the excess deaths in the last 6 months, 63,000 excess deaths over what we normally expect, 64,000 really. Now, we see that if that many died of COVID, that means that some of the excess deaths were either undiagnosed COVID, unrecognised by testing, or unrecognised by the doctors, so there could still be a few. But most of these excess deaths here, this 8,000 or so excess deaths, between that number and that number, this is the total number of excess deaths in this period. Many of these are the collateral damage that we see with COVID-19, for want of a better term. So people that didn't seek medical advice when they had chest pain, or people that were unable to get treatment because COVID-19 patients were using a lot of the facilities. And this is going to be the case all around the world, and we know it is already. We know that HIV treatments are disrupted, which is going to result in more deaths. We know that tuberculosis treatment around the world, which can have to go on for up to a year to treat tuberculosis, 6 months to a year, we know that they're being interrupted. We know that there's more perinatal mortality, which is tragic, mothers and babies dying more than they would because the pandemic is there. Not a direct result of the pandemic, but because of the competition for medical resources. So if this is a more accurate number, and I believe really it is, that gives us an infection fatality rate of 2.28%. based on 2.8 million people being infected in the UK. Now, carrying on with figures, Scientific Advisory Group for Emergencies, SAGE. Now, they are saying that the current R0 in the UK, the current R value, the rate of growth, the rate of growth is between 0.8 and 0.9. As you know, if it's less than 1, that means the number of cases are going down. So anything above 1, we get an exponential growth. That is, we get, what we mean by that is that if it's exponential growth, the rate of growth is accelerating as the numbers of cases accelerate. But anything below 1, we get an exponential reduction. And with an exponential reduction, that means the number of cases is slowing down at an ever-increasing rate. So SAGE is saying that we've got reduced numbers of cases. That's the figure that they published on their website this morning, 0.8 to 0.9. Now, given that the cases are rising, we have the data for the Office for National Statistics from the 20th to the 26th of July. Given that cases are rising, it's likely now on the 4th of August, that the cases are higher than this, and yet the Office for National Statistics are saying they're lower. This is simply contradictory. In my view, SAGE and the Office for National Statistics cannot both be correct. So we've got Scientific Advisory Group for Emergencies saying the number of cases are going down in the UK. We've got the Office for National Statistics, based on real data, it has to be said, saying the cases are going up in the UK. Now, why on earth all the clever doctors and scientists on SAGE don't realise this? It's bemusing to me. But there is a simple contradiction here. They both can't be right. If the R value is below 1, the numbers are going down, as SAGE says. But the Office for National Statistics says the numbers are going up. And there's a blatant contradiction there. And to me, the Office for National Statistics is going to be correct. And all SAGE are doing there is bringing themselves into a degree of disrepute. It just doesn't make sense why they're saying that. Because firm data, 20th to 26th of July. Slight increases in numbers in England testing positive in recent weeks, unfortunately. That's based on antigen swabs. Now, 35,700 people in the community in England and Wales had COVID-19 in this time period. So the number of active infections from the 20th to the 26th of July, 35,700 people. That's 0.07% of the population of the community. This excludes hospitals. This is just people who are not in prisons, not in hospitals, not in care homes. And they say, quite frankly, new infections also increased. And they put a figure on this. 4,200 new cases of COVID-19 per day in England. So this is the Office for National Statistics figure, saying that in this time period, there was 4,200 new cases of COVID-19 per day in England. The COVID tracker app at the moment is saying 2,100 new cases in the United Kingdom per day. So the only way to resolve this is that there's been a sudden reduction in the number of new cases. Now let's hope that's true. 26th of April to the 26th of July 2020. What are the figures there? Now, 1 in 16 people during this time period from April to July. 1 in 16 people, that's 6.2% who provided a blood sample for antibodies for COVID-19 were positive. So that means that 1 in 16 people in the country, according to this data, have had COVID-19, have been exposed to it. 6.2% of the population has been exposed, according to this data. That equates to 2 million people in England and Wales. That's where they got that figure from. And this is not in hospitals and care homes. So the real number's going to be somewhat higher. This is in the community. So that's where that 2.8 million figure comes from this antibody testing. 6.2%. Now, week ending the 17th of July 2020, week 29 of the year. Deaths involving COVID-19 equaled 295, which was 3.3% of all deaths that week. That's the last week this full data is available for because of the delay in registering deaths. There we go. If I can click the right button, yes. Yep. Where am I? I've gone again. There we are. Now, 22nd to the 26th of July, in that time period, 65% of adults in Great Britain worried about the effects of COVID-19 on their life. Now, I'm going to do a video shortly on the psychological effects of COVID-19, because as you see, most people in the UK are currently worried about that. So, to be fair, the only way that the Scientific Advisory Group for Emergencies and the Office for National Statistics are both right is if the cases were rising up until this 26th of July, when the Office for National Statistics data goes to. So that would be up to the 26th of July there, if that's accurate. But given that now we're on the 4th of August, and the Scientific Advisory Group for Emergency says the numbers of new cases are going down, then the only way that would make sense is the graph looks like that. Then SAGE would be correct, and that would be consistent with the ONS data. But when we look at the latest data from the world data, that one, well, it's not what we see. We see the numbers still going up in the UK. So we see an inconsistency between ONS and SAGE. So how do we resolve this? Well, what we're seeing in the UK at the moment is an upsurge in cases that's more regional. And because of the lockdown in Leicester and the Manchester area, and the cases being, the restrictions being, not so much the restrictions, but the education and the community involvement in places like Liverpool, I'm fairly hopeful that these regional outbreaks can be contained. Now, Spain, with well over 500 regional outbreaks, that's going to be all the much harder to contain. So cases could start increasing in Spain, but in the UK, I'm hopeful we can keep them under control. But the latest data shows that the numbers are not yet going down. They're still going up slightly, if anything, unless you want to accept the SAGE figure. So the bottom line is numbers probably still are going up, and SAGE aren't quite right about this, because I trust the Office for National Statistics data. Now, the differences, to be fair, aren't massive. If we maintain vigilance, I think the cases in the UK can remain level. I don't think we're going to go back into exponential growth. But that risk is always there. It's always there. That the second wave, or the continuation of the first wave, could be twice as bad as it was in April, May. That risk is there because, as we see, only at most maybe 7 or 8% of the population. Office for National Statistics figures are 6 point something percent, wasn't it? 6.2% have been infected. So if it's, let's say 7% have been infected, that means 93% still have no immunity to this virus. So that was all about the UK. Let's have a chat with Carolyn now and get a bit of a perspective from Australia as well.
Yeah.
Carolyn, thank you for coming on, but I see you're very busy.
Hi, John. Yeah. Yeah, we've got this two or 3 day old orphan goat at home with another goat as well. He's taken quite nicely to the bottle, but the girl hasn't.
Drank that quickly enough anyway. Whereabouts are you, Carolyn, in the world at the moment, please?
So we're at Little River, which is in Victoria. So it's between halfway almost between Geelong and Melbourne. So
you kind of Melbourne commuter belt sort of thing, is it?
Pardon?
Are you sort of Melbourne commuter belt?
Yeah, that's right. Yeah, it doesn't take long. The freeways are straight running to town. And yeah, we own our own butcher shop, which we took over a 103-year-old butcher shop on the 17th of March, which was right before the first lockdown.
Yeah, but you have another day job as well, don't you?
I do. So I've been nursing
sometimes.
basically nursing since I'm 15.
Okay.
But I work night shift. Yeah, that's my role is on night.
What sort of hospital is it? What sort of unit do you work on?
So it's not a unit. So I work on my own overnight, and I have a pager. So you can hear the kids. I have a pager, and I get all the emergency calls throughout the hospital. So I attend to them, no matter what unit it's on, usually.
So you're like a nurse practititioner, really, aren't you?
Yeah, and I get met with the ICU team, and basically it's to help all staff throughout the hospital, the nightlife staff, and you run at a reduced capacity overnight. So if I can attend, then that allows nurses to get on with other jobs, and care for all the other patients while I'm at the emergency, or vice versa. If they're already into it, I'll just pick up and start doing everything else they need to for their patients. So, and I get asked a lot of different questions as I'm going around. I think, using all my skills, because I've been nursing since I was 15. I was a ward assistant at a nursing home, so I got trained, there, and then at the Alfred, I did my postgraduate year there.
So what's the situation like in the Melbourne area at the moment? Are you fair? It's what is it now? The 4th of August, isn't it? So are you sort of fairly locked down at the moment? Are you restricted in what?
Yep. So everything's locked down. There's a curfew from 8 o'clock at night, unless you're going out for certain things like travelling to work or from work, needing medical care and stuff like that. In regards to with our family butcher shop, things are scaling back in abattoirs because they've been a really big source of infections. I think it's just the way they work. They're working close proximity, long hours. I don't know if cooler temperatures are to play, but also when one shut, I think casual workers went to the next job. And of course, we know that a lot of people that can't earn money, if they're not unwell, they're going to go on to the next place. And unfortunately, it may be, the mode of transmission. I think there's so many cases, it's hard for them to contact trace everyone at the same time. So it's just gotten really out of hand. It's really scary. And
are people obeying the curfew and the restrictions and wearing masks? Well, is the public going along with the agenda?
Yeah, I think it's only been a couple of nights, but coming home, because we close at 6 o'clock from the butcher shop, which is in Brighton, which is in town on the Bayside area, there seems to be about the same amount of traffic, but everyone looks to be, you don't know, but it's probably work traffic. People are driving home. You have your dinner at 7, whatever else.
And what about mask wearing? Are people wearing masks?
Yes. So everyone that's come into our shop today, everyone's wearing masks. You can see it down the street. Some people are wearing the shields, the face shield, the plastic one, because they can't really, they get a bit claustrophobic. They explain it to you as soon as they're coming into your shop or whatever. They just say, I've got a letter, and they don't have to show me the letter, but they stood outside the shop and we just served them, so that was fine.
And in the hospital, everyone's wearing masks, of course. That's universal.
Masks and a shield. So last time I worked was last fortnight, and we had to wear a mask or a shield or goggles, but now it is mask and shield.
You're wearing both,
and emphasis on distancing, especially during breaks. I'm kind of lucky because I work on my own at night. Even though I'm with people, when I have my break, I'm nowhere near anybody else. So,
but of course, you have to physically examine your patients.
Yeah, that's exactly right. So it's really hard to distance when you are in that assessment role, but you're always mindful. I think the exhaustion, because I'm so used to working night shift for more than 20 years, I've been working night shift. The exhaustion comes from constantly thinking, I've touched the lift button, sanitize, because there's sanitizer right there. I'm selecting the floor I need to go to, sanitize. Hello. Just constantly thinking, distancing, sanitizing it. The hard thing is when you're nursing elderly patients and they might have sundowners at night, and you're going into them, you've got a mask, a shield, a gown, and they're so frightened. And I think that's been the worst thing, being able to communicate with people hard of hearing.
You must look pretty frightening to people that aren't familiar with this kind of PPE.
Yeah, it really upset me. Yeah, the last shift I worked, I walked out and thought, that poor lady, non-English speaking, doesn't understand why we're wearing all these things, won't take medications. Yeah, it's just hard. So that's on the non-COVID area. So
So you kind of had a first wave in Melbourne, didn't you? You had a few cases a bit back. Then you had a nice lag, and now it's kind of
we got to zero. Yeah. well, that's what we thought, went to zero, but there had to be pockets of it somewhere. But we've done over 1 million tests. What is it? 1.7 million tests almost in Victoria alone.
In Victoria.
And 3 of them are mine. I've had 3 tests.
And have you been negative so far, Carolyn?
Yeah, absolutely. Yeah, and just with one symptom, you just have to call it off, go and get tested. And I got tested at work, so you get the test result back pretty fast. The first test, I went to a drive-through one at a shopping centre, undercover car park. It took 7 days for the test to come back, so I missed out on 3 shifts, but it's keeping everyone safe because you don't.
But is the testing faster than that now?
I think, well, I'm not quite sure. I have seen people in this area put on our local Facebook that it's taken time and time and time. But I do have friends that work in pathology, and they're getting slammed. Of course, what people have to understand too, it's not just these swabs that are being looked at. Everyone's still getting their normal bloods done. People on warfarin, the INRs. The pathologies are doing other things as well. So
it must be pretty flat out then.
Yeah, absolutely. Yeah. So I haven't had my leave. Twice. Doesn't matter. Not going to go anywhere anyway. Not now. And my friends that work in pathology, their leave. She was one of my friends was on leave, and then they called her in the next day. So she knew. Yeah, she sat with her feet up for 1 day. So
were you seeing COVID patients back in sort of April, Carolyn?
Were we seeing them?
Did you?
So what happened? We had the clinic, the COVID clinic, downstairs. So we had a lot of people come in all at once because DHHS, Department of Health and Human Services, had called people that had come on flights from Sydney to Melbourne to say, get yourselves tested and all this. So I think it was all just new to Australia. I think because of where we're located, people thought it couldn't possibly happen. But we know that we had ships come in, the planes come in. Yeah. And even I spoke to my son today. He was saying, isn't it like the flu? I said, we're not seeing much of the flu. I don't know the stats, but in the hospital, we're not seeing much of the flu. And I think because it comes in via the planes, really. So,
of course, it doesn't walk there, doesn't swim there, does it? It's all
that's exactly right. So I wrote down a couple of things. So we've got the Doherty's Institute here in Melbourne, and they're doing some studies and have got government support and backup. Human stem cells to understand the effects of COVID-19 on different organs, and a collaborative with the Burnett Institute as well here in Melbourne to develop a point of care test to measure immunity, to SARS-CoV-2. So I was thinking back to one of your clips on SARS-1, wasn't it? People have got antibodies.
That's right.
All this time later.
Yeah.
So we live in hope. I've been supporting a few people dropping off care packages and that are positive COVID, and they're all displaying lots of different symptoms. And I just wanted to say one of them is a very young, fit, and was one of our Olympic fencers. And she's under 50, and she's got it via community transmission. And it's not great. But we did drop off some goat milk with colostrum, so hoping that will help her out, because I've had it before.
It's not going to do any harm.
Unwell, and it helps. It's got all the antibodies in it, so we'll live to see. But she's got a lot of the GIT, so mucositis and stuff like that. So, and it really does help. You just have a little swig of it. So every day.
I mean, obviously we can't reveal who we're talking about, but we've got gastrointestinal symptoms.
Yeah, yep. And so febrile, SATs are okay. I think it's the lethargy as well. Lethargy is really bad.
Yeah. The
and it's not like them when they're that fit as well,
Have you seen patients with respiratory problems?
I haven't myself. Because of the nature of my work, I'm not to go to the wards that we know where people
right. So you've COVID and non-COVID parts of the hospital.
Yeah, because I also I insert IVs and do all sorts of things. job to help doctors as well. So I can't be going to, say, the bone marrow unit and inserting an IV when I've been to a ward like that. But we're still all doing the PPE and concentrating, on that to lessen the chance of transmission.
How is your hospital geared up for potential future waves potential future cases over the next few weeks, Carolyn?
How are we, sorry?
Are you geared up for any increase in cases over the next few weeks?
So we've been we have been really focused on being prepared. It's been amazing. We've got really good supports from our CEOs and everything like that. We've got capacity to expand quite a bit in relation to ICU, and we've got lots of centres around us and in just out of Melbourne as well to be able to place patients as well.
Right. So if there was an influx of really quite ill patients, you can greatly increase the capacity that you have at the moment.
Yeah, but we're hoping that this lockdown now really reduces those numbers, so we don't get that 5% of patients that are really needing to be coming in. Because we cover a whole lot of different.
The overall numbers in Victoria now aren't massively high. It's more the rate of increase that's been concerning, isn't it? And
that's right. And I think
potential growth without the intervention.
Yeah, that's right. I think it's also the amount of people that we don't know exactly how they've acquired it as well. There's no way they can pinpoint where they got it, so it's obviously acquired.
So it's obviously been there all the time. Well, it looks like it's been there all the time. It's just that
I think so too. Even when you said before, it's gone down to almost zero, but it obviously was still there. And I think it's a nasty little thing. It's trying to look for ways to get itself in. To people.
So all you need is 1 or 2 cases, and the fact that the vast majority of the population have not experienced this novel virus before. Because even in the UK, it's probably only about 6% of the population, 7% of the population have been exposed to this virus. So in Australia, it's going to be way lower than that.
Yeah.
So the opportunity is still there, isn't it? This is what we need to get a hold of. It's not gone away yet, but not by any means.
That's right. And we're in our winter as well, and people already come down with certain immune situations as well. So it's going to really lock into that, I think, if you've got it and you are asymptomatic. But I just worry for all the elderly, and I kind of wish back in February people knew to lock themselves away if they were immunocompromised or in a home or just.
Yeah. And I don't know if you want to go. I don't know if you want to go to this, Carolyn. I mean, it's entirely up to you. But I know you've had to do some fairly emotional online things yourself recently, haven't you?
Yeah. So I cared for my mum at home. She was palliative with cancer and passed away in April, and we could only have 10 attend the funeral. So none of my family got to come. My 4 kids or my husband. And today I attended a funeral on Zoom for my auntie up in Queensland. So. Yeah, it's pretty surreal, but I think it's great that we have the technology to be able to attend.
Yeah, well, first of all, thanks for telling us that, Carolyn. I know it's been difficult. We appreciate that, and the reason I wanted to do it was there's just so many other people around the world have suffered, and I'm not using that term exactly, suffered.
That's right.
In exactly the same way, and
exactly.
It's just kind of good to know that we're in the UK. My dad's in hospital at the moment. I can't visit him.
That's right. It's the same here. No visitors.
People all around the world are suffering in the same way. We're in this together, aren't we? It's
that's right. Exactly. Yeah. Even when I was speaking about elderly people not and at night time and they're scared and all us coming in, usually someone like that, we might have a relative next to them overnight. They might stay overnight and settle them, but we can't have that. And even on the phone, it's not like seeing them in front of you. So it's really
especially when someone's confused, I mean, when you're confused, you can still feel someone's hand, can't you? And
that's right.
You still, the sound is the last thing to go. You recognize the voice, and to have that cut off.
It's exactly, that's right. Yeah, but we've got, you know, nurses and allied health doctors. We've all got lots of support in each other.
Yeah.
I'm on peer support and do quite a few things in that role. I'm on duty for 5 days, I think it is, starting tomorrow. So you can get a call. We've got always got 2 peers on at one time. If the first one doesn't pick up, the second one gets the call, and we've got a lot of assistance that way. So that's really good.
Yeah. So
Trying to
apart
help
from
each
working
other.
full time as a nurse and looking after 4 kids and adopting 2 orphaned goats,
Yeah.
what do you do in your
Yeah.
spare time?
I always looking online, studying. I've got books, and my daughter's in Townsville. She's studying biomedical sciences up in Townsville. So she's been up there since February. And she sends me her papers to go through them and have a look at them as well. So I'm always interested.
You're a busy lady. You're a busy lady, Caroline.
Yeah, I've tried to scale it down from last year, the middle of last year, but it hasn't worked. I have to keep my mind busy.
Yeah. Right, there's a lot of people in Australia listening to you just now. What do you want to say to them?
I just want to say, keep your chin up. Everyone's doing as best they can. I think the right people will be watching this, because the people that weren't doing the right thing, they won't be watching anything as
I
good
guess
as
we're
this.
kind of preaching to the converted, really, aren't we?
Yeah, exactly. That's what I always say. People are writing things online. They go, "Oh my God, stay at home, people." And I'm thinking, the people that are looking at this or looking at your comments, they're not the people you need to be telling. So I think also they're saying we're the first line of defence and whatever. I think that the last people you'll see, because if you need to come to hospital to do with COVID, of course, not all our admissions are COVID related. We're still getting our strokes. We're still getting traumas and
of course,
anything else.
Yeah.
But, you know, we are really the last line of defence. If you've got to come, you're pretty unwell. And we want to get you back to wellness and back to home to your loved ones where you can be with them, because in hospital you can't. So,
but I'm sure everyone in Victoria appreciates you being there, Caroline.
Yeah, and I just appreciate everyone else. I bought online. There's a group, and these ladies have set up a co-op, and they're sewing scrubs caps, and they're sewing also scrubs and everything, and that's in Western Australia. So I bought a whole set of them, 8 scrubs caps and a couple of bags to put my scrubs in, because I've been using a pillow slip to put my scrubs in when I get changed and have a shower. And then I just chuck all of that in the machine and wash it that way without touching my scrubs again. And they get washed on their own. But people are pulling together, farmers' wives are sewing, everybody's doing their bit to try and help us. So it's really appreciative.
Yeah. So do you want to come back on in a few weeks' time and tell us how things have panned out?
Yeah, I hope that this lockdown makes a difference and we get these numbers down.
I think it will. I'm optimistic.
Yeah. We've seen it before. We've seen it happen before, so we can do it.
I'm optimistic that Australia can keep the numbers down because it's taking this so seriously.
That's right.
That it can keep the numbers down until we get a vaccine.
Yeah, that's it. Yeah. That's exactly right. Yep.
Yeah, and I have to apologise to the entire population of Australia for calling your governor. No, it's not governors. It's who's in charge of the state?
Oh, the premiers.
Premiers, right. It's premiers, not governors. I'm mixing it up with another ex-colonial country there, I'm afraid. So
that's right.
Yeah, we'll leave it. Caroline, thanks very much. I'm gonna cut that. That's brilliant. Thank you.
Thanks, John. Really appreciate it.
Yeah, it's been great.
Well.
Thanks. And good luck with those goats. I hope they go back to, because the parents have died, haven't they? That's the whole point.
Oh, they've just left them. We don't know who their mums are. There's so many out there, and I don't know, when they have their babies, they have all these hormones going through their body and they just forget. And then we have to pick them up and feed them for about 8 weeks, and they'll go back into the paddock with all the kindergarten of kids.
They're probably luckiest 2 goats in Australia.
They are, because they're in the warmth. We've had snow today at this level and we're at a low level.
Yeah, so, good winter time there. Yeah,
it is. Yeah.
Great. Thanks, Karen. God willing, we'll talk again in a few weeks' time.
No worries. Thanks, John.
Thanks.